Cortical aspiration, a clean sweep. Cataract surgery today is one of the most successful procedures for restoring quality of vision. And yet, how many times have we felt disappointed by the appearance of a slight posterior capsule opacification that mars the visual satisfaction for the patient? Maintaining a clear posterior capsule is becoming more crucial than ever before. The surgical step of cortical aspiration becomes very important to achieve a clean capsular bag. As we know, the equatorial cell nests in the capsular fornices are the actual proliferating cells. If left behind, these are the culprits for causing posterior capsule opacification. Is the current technique of cortical aspiration always effective in removing the equatorial cells? Perhaps we need to critically relook and redefine our objective and technique of cortical aspiration. You may wonder, what is so difficult about cortex removal? All you need to do is hold, pull and aspirate the cortical fibers, and voila, the bag is clean. But is it clean enough? We propose a technique to maximize the removal of cortical fibers and equatorial cells. We call it the clean sweep technique. Take a close look at cortex aspiration being performed. The surgeon is pulling the anterior fibers centripetally in a radial motion. This action exerts a pulling force on the anterior fibers and will successfully detach them. But will this be enough to remove the cells on the curved capsular fornices? Look at this model here. Imagine this is the capsular bag. The lens epithelial cell fiber complex is seen. A centripetal pull will detach the anterior subcapsular fibers. But there's the catch. The direction of the pull will cause the fibers to break off from their attachment to the equatorial cells. The result: residual epithelial cells and fibers. If these very cells are left behind, no amount of anterior or posterior polishing will be able to prevent PCO formation. Let us understand how the clean sweep technique promises to ensure thorough cortical cleanup as well as equatorial cell removal. Just keep in mind the acronym POPS. Position. The aspiration port is positioned underneath the anterior capsular fibers towards the fornix. Occlude. The anterior cortical fibers are occluded. Posterior detachment. Take the occluded tip posteriorly to detach the cortical fibers off the anterior capsule. Swipe. Circumferential, arc-like swiping movements are performed to further detach these fibers from the capsular fornix. It has been shown previously that these circumferential movements are much more friendly to the zonules than the radial pulling movements. Once the cortical fibers are detached off the fornices, step up the vacuum, bring the probe to the center, and there, complete aspiration is accomplished using linear vacuum and flow rate. Aha! Can you see the clumps of equatorial lens epithelial cells being removed so effectively as the cortical fibers from the equator are being aspirated? Now this is guaranteed to leave behind a cell-free, clean bag. The external view highlights the downwards and side-to-side movements that make cortex aspiration so effective. Posterior detachment of the fibers, followed by swiping movements, will result in complete removal of the fiber-cell complex. We also tested this technique in the laboratory. Cadaver eyes were subjected to cortex removal using the radial pulling technique in one group and the clean sweep technique in the other. The capsular bags were dissected and stained to detect residual lens epithelial cells and fibers in the fornices. The area marked here is the region of the capsular fornix. In the horizontal pulling group, residual lens cell fibers are visible in the fornicial regions. But strikingly, in the clean sweep group, the fornices appear clean. A clean sweep indeed. And that's not it. The clean sweep technique has extended applications in various scenarios, like corticocapsular adhesions, small pupils, or weak zonules. What's more, with femtosecond assisted cataract surgery, the femto division leaves behind a sharp cut edge of the cortical sheet. In the absence of free fibers, it is essential that the aspiration port be placed underneath this sheet of cortex and the clean sweep technique be adhered to. This will make cortex aspiration much more effective. The clean sweep technique works well both with the bimanual and coaxial approach. It is time we redefine our aim of cortical aspiration. Thorough removal not only of the cortical fibers but also the epithelial cells hidden away in the fornices. To recap, just remember the 4 steps or POPs: position, occlude, posteriorly detach, swipe, and finally aspirate. By adhering to this technique, you are guaranteed to make a clean sweep time after time.